Welcome to Tuesday's edition of COVID-19. The fall semester begins today for local middle and high schoolers amid daily infections well above 1,000 and debate over the threshold for herd immunity. Now, we have more on this later on the program with our panel of experts. We start as always with the broader pandemic coverage with our Kwon So-ah. Now, so I believe there's been a slight drop, that is, in our new COVID-19 cases on the local front.
That's right, Sunny. Around 180 fewer cases compared to Monday. 1,373 is the caseload we're seeing as of 12 a.m. this Tuesday, which includes 323 domestic infections and 50 cases from abroad. Now, that has raised the total number to 226,854, and we've also got 6 more people who have lost their lives due to COVID-19 in the past day. And for the past 4 days, we are seeing infections are going down, but we also have to factor in that we had a 3-day holiday due to the National Liberation Day. So that could be an after effect of that holiday season. Authorities are expected to make a decision later this week on whether to extend current social distancing measures for a longer period, monitoring the remainder of the week, the trend of infections, and that because Liberation Day coupled with the vacation season, there is a possibility of another surge.
Many experts are indicating that this week, when people return from their vacations, could be an inflection point in the 4th wave. Once again, I ask citizens to get tested for COVID-19 before returning to their workplaces, whether they have symptoms or not.
And in fact, there are already people that are cooperating in getting tested, as there have been numerous cases detected at some of the makeshift screening centers at rest areas when people have been going back to their homes after vacation season. Now, because of the vacation season, we are also seeing scattered infections across the nation, triple digits this Tuesday in Seoul, Gyeonggi-do province, as well as Gyeongsangnam-do province, and Jeju-do Island did see a decline from over 60 cases yesterday, but now is expected to have level 4 social distancing measures implemented beginning Wednesday.
I see. Meanwhile, so let's move on to the government's briefing earlier on this Tuesday morning regarding the delay in Moderna vaccines to the country.
Sunny, following the U.S. drug maker's notification recently to South Korea that it won't be able to ship its planned amount of COVID-19 vaccines due to laboratory issues, Vice Health Minister Kang Do-tae said this Tuesday that Moderna vows to fast-track and also expand its future shipments to Korea. Now, the official cited the pharmaceutical company as saying their earlier glitch has been almost solved, with delayed shipments that were promised for July and August having been requested by Seoul to be completed in early September. He added that details on the schedule and volume are to be released later this week. Kang led a delegation that headed to Moderna's headquarters last week to protest against the company's notification to Seoul that it could only supply less than half of the 8.5 million doses of its vaccine promised for August. Now, so far, South Korea has vaccinated 23 million of its population with at least 1 dose, and 9.9 million are fully vaccinated, which is equivalent to 19.5%. Now, onto a concern not yet here in Korea. The Lambda variant has been confirmed in another Asian country, the Philippines, following Japan, Bangladesh, and India. The dominant strain in South America, which was first detected in Peru, has made its way to around 40 countries, including in Europe and the U.S. Now, it is categorized as a strain of interest by the World Health Organization, but some figures do suggest a higher mortality rate. And a country that's even considering a lockdown if it detects a Lambda variant is Israel, which is fearing that vaccine efficacy will decline. Speaking of which, Israel has now vaccinated more than 1 million people with booster shots. And the U.S. is also considering booster shots in fall, which is seeing resurgences in cases. Over the weekend, we also saw that Indonesia has surpassed Germany in its total caseload, and this past day, Iran has surpassed Italy with over 4.4 million infections in total. And we are seeing over 700,000 new cases around the world, raising the total to 208.6 million. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, meanwhile, surplus AstraZeneca vaccines are available here in Korea for those aged 30 and above. For more on this, I have our Ji-young here in the studio with me. Welcome, Ji-young.
Hi, Sunny.
Right, Ji-young, let's begin with the surplus vaccines and ways to access them.
Sure, Sunny. As you said, starting on this Tuesday, people aged 30 and above can apply to receive no-show AstraZeneca vaccines. Bookings are available on a number of social media apps, including Kakao and Naver. Health authorities say the decision was made after many AstraZeneca doses were disposed of recently because of people who did not show up for their appointments. Meanwhile, another 1.1 million doses of the AstraZeneca vaccine, enough for more than 500,000 people, rolled out of an SK Bioscience production facility in the city of Andong in southeastern Korea. The latest batch accounts for a portion of the 20 million doses that the government purchased directly from the pharmaceutical giant. The government plans to make delivery of some 18.6 million Pfizer, AstraZeneca, and Moderna doses until the end of this month. Health authorities once again urged people to get their shots after a recent survey showed that only 0.33% of the nation's population possessed COVID-19 antibodies. Take a listen.
Given the low presence of antibodies in our population, it's important that we achieve herd immunity by encouraging more public participation in our vaccination campaign.
Right, and speaking of herd immunity, I understand authorities are looking to reset that threshold.
That's right, Sunny. Originally, the government set a goal to fully vaccinate 70% of the nation's population by November. But authorities say although that target could be reached ahead of schedule, the herd immunity threshold may need to be adjusted due to the fast-spreading Delta variant.
We will reevaluate our vaccination goals needed to reach herd immunity based on the realities of the current situation, including the spread of the Delta variant, its reproduction number, and other factors.
Meanwhile, vaccine bookings for those aged from 18 to 49 is continuing to roll along. Those born on the 7th, 17th, and 27th of any given month can register starting from 8 p.m. today to 6 p.m. tomorrow. The government estimates that around 70% of people in this age bracket are willing to get vaccinated based on the number of appointments made thus far. Those aged between 50 and 54 are now getting their first shots at designated medical facilities and vaccination centers nationwide. According to the current timetable, first dose inoculations for this age group will be complete by next Saturday, with their second doses being administered 6 weeks after their first. And they'll be getting either Pfizer or Moderna vaccines.
I see. Meanwhile, Ji-young, the autumn academic term has kicked off, right?
Yes, that's right. Even with the highest level 4 social distancing measures in place, roughly a third of all students in the capital region will attend classes in person. In regions under level 4 restrictions, first and second grade elementary students are back in school to take in-person classes. From the second week of September, 3rd to 6th graders will also return to school, but at less than half capacity. For middle schools, in-person classes have resumed at 1/3 capacity until September 3rd, and the cap will be raised to 2/3 starting from the second week of September. In-person learning for high school seniors has fully resumed as most of them have been vaccinated. But for high school freshmen and sophomores, their classes will operate at half capacity. Schools will operate under a higher ceiling in general for other regions under level 3 social distancing measures.
All right, Ji-young, as always, thank you very much for the coverage.
Thank you for having me.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Tuesday. And while we wait for that to start, let's take a quick look at the inoculation appointment timetable for those aged between 18 and 49 here in the country. As Ji-young mentioned, I'm afraid the briefing's about to start. We'll come back to you afterwards.
We have Mr. Lee Sang-won with today's briefing.
네,
I am the director of the Epidemiological Investigation Task Force, and let us now begin our regular briefing for August 17th. Starting from today, we are having the third local autonomous vaccine program, and here are some updates. Considering the COVID-19 status right now, we have the local autonomous vaccine program where we are giving the authority to the local governments, and also we have had the second rounds of the vaccines, and this is the third round, and also the eligible recipients have also made their bookings via the call centers as well as the website, and we have over 1.3 million people who have already booked their vaccination appointments, and we are also providing the Pfizer vaccines for this group of people. And next, also as for the vaccine program for those aged between the 18 and 49, and until the 17th, 8 p.m. 17th, we are also receiving the vaccination booking for those whose birthday end with 6. And starting from 8 p.m. today, we are going to open the reservation booking for those whose birthday end with 7. And also until we have until the end of the booking period, we have about 5.6 million people who have finished the booking process, which account for about 60.3% of the eligible group. And among them, there are also people who have received the surplus vaccines or have already been inoculated with other programs, and there are about 6.7 million people who have already done so. And also, as for those under the age of 40, we also have many people who have already been inoculated, and we are also seeing the vaccine reservation rates, and we estimate that about 70% of these age group are willing to get their vaccines. And after the 10-day rotation reservation system, we also have several days left until the vaccine appointment booking is open to the public. So we believe that this vaccine reservation rate could also increase going forward. And moreover, as for those who have already made their reservations, please also abide by the designated dates to get your vaccines. And as for the vaccine supply, we have the AstraZeneca vaccines, about 1.1 million doses that have been shipped out of the Andong facility. And also on the 18th, we also have the Pfizer vaccines at about 1.6 million doses set to arrive in Incheon International Airport. And we also have additional 1.3 million doses of the AstraZeneca vaccines to be shipped out from the Andong facility. And we also have in schedule a total of 6 million vaccines of the AstraZeneca vaccines and 5 million Pfizer vaccines to be shipped out until now from the beginning of August, and this amounts to about 14 million supply here in South Korea. And going forward, in order to have a stable supply of the vaccines, we are going to have continued discussions with these drug makers going forward. And next, at nursing hospitals as well as long-term care centers, we have been seeing cluster infections, and here are some epidemiological investigation conclusions. And at these cluster infections, we have seen that there have been cluster infections at these facilities where people have been already been vaccinated. We have had about 9 cluster infections, and about 7 facilities we have been looking at the vaccination rates as well as the severity of the symptoms, and we have looked at about 800 people, and a majority of them have been inoculated, and also 5 of the facility were inoculated with the AstraZeneca vaccine, while the rest 2 were inoculated with the Pfizer vaccine. And also we have seen 24% and also 78% were the residents and also workers respectively, and we also see the breakthrough cases being at about 18% in average, and also among the users and the residents, this amounted to about 25%, while 7.7% for the staff members, and the critically ill patients accounted for about 4.4%, and the fatality rate stood at about 7%. And as for the ratio of the critically ill patients among the vaccinated, it was only about 1/4 compared to those who have not been inoculated. And we believe that this has been shown that we can prevent the severe symptoms after inoculation by about 75% if you are inoculated. And we also see that we are having a decrease in the fatality rate and also the critically ill symptoms if you have been inoculated. And despite being exposed to such cluster infections, we see that even after being exposed to the 3C environment and also the fueled by the Delta variant, we believe that these were some aspects that have led to the latest cluster infections at such long-term facilities. And we believe that at long-term facilities, they are prone to virus infection, that is, because they are also in a confined space with little social distancing measures. And going forward, we will conduct the full vaccination for any people who have not been vaccinated there. And going forward, we believe that it is very important that these facilities abide by the basic quarantine measures. And next, we also have some updates on our detection of the new variants here in the country. And we see that we have been showing efforts to elevate our monitoring of the new variants. And the ratio have amounted to about 27% when it comes to monitoring of the new variants. And we have seen the detection rate of the new variant standing at about 86%, which is about 11% on week rise. And the Delta variant, we have seen that this has been on a rise by about 12% from the previous week, standing at about 83%. And we have identified 3,013 new variants, and also we have a total of 13,700 cases that have been detected here in South Korea, and a majority of them were local infections. And we also have some breakthrough cases after vaccination. Here are some updates. And after February, where we began to roll out the COVID-19 vaccines, we see there has been a total of 120,000 patients. And also we have been seeing that about 1.6% of these people have been fully inoculated. And we have been looking at about 7.3 million people who have been inoculated. And we saw that about 2,000 cases were infected with the breakthrough infection, amounting for about 0.03%. And we believe that a majority of them were in the 30s age group. And we have also seen a decrease in the general detection of such breakthrough cases. And as for Janssen, this stands at about 0.082%, and also Pfizer 0.015%. And also the cross-inoculation stands at about 0.008%. And we also have been looking at about 500 cases where we see were under the detection of the new variant. And among them, about 70% were identified to be infected with the new variants. And going forward, we have concerns that we could see a rise in the number of breakthrough cases. However, here in the country, we are managing this at a very low rate. And we also see that when inoculated, people will suffer from a decreased level of fatalities or severity of the symptoms. Right now, we are also seeing a third major outbreak globally, and we believe that we are seeing about the confirmed cases increased by about twofold from the previous major outbreak. And we believe that this is fueled by some countries like Vietnam and others, which are having difficulties in controlling the new virus spread. And we also see many countries with the high inoculation rate, even the US and UK, seeing increased numbers of new cases. And as for South Korea, our objective numbers and figures are also very positive compared to others. And when we consider other countries where we have a high level of vaccination, including US, UK, France, and Germany, South Korea has a relatively low, significantly low rate of fatalities. However, we need to going further. We need to see the need to have an effective control over the various virus spread, and we believe that it is also important that we have our public vaccinated going forward. And as for vaccination, after the emergence of the Delta variant, many people were questioning the efficacy of these vaccinations. Considering the nature of the Delta variant, people have questioned that there could be a decreased rate of the efficacy when it comes to new vaccines. This is true to a certain point. However, it is very important to note that the vaccination is highly effective in preventing COVID-19 related death. And also in many other countries, they have also seen and witnessed that the COVID-19 vaccine is effective to prevent the COVID-19 related death by about 80%. And as I mentioned earlier, with the cluster infections stemming from the long-term care centers, we also see the efficacy rate standing about 75%. So we want to highlight once again for you to participate in the inoculation program. And also lately, we have also seen many people who are also requesting the testing of the antibody level, and here are some details. The antibody survey and the antibody analysis is done for the people who could be infected with the COVID-19 virus. However, this cannot be used in substitution of the PCR testing as a preemptive measure. And also we believe that this antibody rate is not to see whether we have enough level of the antibody so that we do not need to have ourselves vaccinated. And we also see the risks of people avoiding and being hesitant to receive the vaccines after seeing such antibody testings. And also some people could also see a positive testing results of the antibody. However, this does not mean that this person shall not get the COVID-19 vaccines. And we believe that the antibody cannot fully prevent one from the COVID-19 infection. So we believe that vaccination is more important going forward. I thank you all for your efforts and cooperation. Thank you very much.
Right, that was Lee Sang-won with Tuesday's afternoon briefing, and I have our Soa back here at the desk with a summary of his address. Right, Soa?
Right, Sunny. It looks like we are seeing a rise in breakthrough cases as well as variant cases here in the nation. So let's begin with the new number of confirmed variant cases in the past week here in Korea. 3,014 new cases were confirmed, especially with a rise in the highly contagious Delta variant. And there's been also more reports of breakthrough cases, and that especially being an issue at nursing hospitals and nursing homes, as the government made an assessment of cluster infections at such facilities since late July. And there were 9 clusters, and they made a thorough analysis on 7 facilities. And those have been analyzed in detail on vaccination rate, infection rate, as well as breakthrough case rate. And it was found that some 18.5% were breakthrough cases. So with that, the official acknowledged that at high-risk facilities, such breakthrough cases are possible even if you have been fully vaccinated. And also a quick update on the nation's vaccination vaccination schedule. The third round of autonomous vaccination by local governments has kicked off. So far, some 990,000 people have been inoculated through these programs, and who is subject to these vaccinations will be decided by these local governments.
I see. All right, so as always, thank you very much for that.
Thank you.
Right, local authorities are seeking to support farmers here hard hit by the scorching summer and devastating droughts amid the challenges brought on by COVID-19. To take a look.
Droughts triggered by the scorching heat and an unusually dry summer have had a devastating impact on Korean agriculture. Zucchinis are the signature crop here in Hwacheon County, but farmers here have been forced to discard most of their fresh harvest.
가슴 아프죠. 가슴 아프고 울고 싶어요, 진짜. 이제 누가 어디다가 하소연을 했지.
This sad reality has been caused by supply chain disruptions amid the pandemic and plummeting demand from restaurants and school cafeterias, many of which have shuttered due to social distancing restrictions. The double whammy of falling demand and harsh weather conditions has left many farmers fighting for their very survival.
수도권이 지난달부터 이제 4단계로 변동하면서 이제 저희 농산물 가격이 7월 달에 급격히 하락을 하게 됐습니다. 그 방학철을 또 맞고 또 휴가철 또 막 겹치는 바람에 그 소비처가 굉장히 많이 급감하는 실태였습니다.
But local governments are stepping forward to offer them a lifeline, acting as an intermediary to help them sell fresh produce directly to individual customers.
재경군민이라든가 동문회, 그다음에 사회단체 그런 데서 이제 주문을 받아가지고 이제 직거래를 일단은 먼저 유통을 시켰고요. 그리고 이제 온라인 판매에 저희가 이제 중점적으로 주력을 했습니다. 저희 그 자체 쇼핑몰인 화천 농산물 스마트 마켓을 통해서 접수를 받았고요. 그때 마지막 주 일요일에 3시간에 100톤 가량의 주문이 한꺼번에 들어왔습니다.
The initiative has been a success, with the produce quickly selling out, with a long backlog of customers. Elsewhere, other regional authorities are also working to save their beleaguered farmers who are struggling amid COVID-19. Here in the city of Chuncheon, signature crops from the area are being packaged into bundles and given to residents in the area.
학생들이 원격 수업을 하게 됐기 때문에 정상적인 학교 급식이 이루어지지 못했습니다. 그렇다 보니까 거기에 들어가는 급식의 불용 예산을 가지고 지역의 농가도 돕고 지역의 그리고 납품업체들 또 도우면서 학부모들에게는 식비라고 하는 부분에 있어서 그 경제적인 부분을 좀 경감시켜 줄 수 있는 그런 사업의 일환으로 진행하게 되었습니다.
To keep vegetables fresh amid the summer heat, drive-thrus were set up for people to come and pick them up. Inside the box are 10 locally sourced farm produce, including bell peppers, asparagus, zucchini, and garlic, along with several meal kits.
우리 손주가 학교 다녀갔고요. 이거를 주신다 그래갖고 받으러 왔어요. 우리들은 진짜 너무 고맙고 잘 먹죠. 또 이게 또 코로나 때문에 많은 도움도 많이 돼요.
지역 농산물이라서 싱싱하고 또 좋은 제품들도 넣어주셔서 가정에 많은 도움이 되고 아이들도 또 맛있어하고 좋습니다.
Over the course of 10 days, these packages worth around $43 each were delivered to 20,000 households in the area. Similar efforts are being made by other communities nationwide to help farmers who are struggling amid the pandemic. These endeavors have provided farmers with new sales opportunities and allowed consumers to make more savings on their grocery bills. Regional governments are brainstorming even more new ideas to support local farmers.
먹거리를 먹는 소비자, 그리고 또 생산하는 생산자 주체, 그리고 그것을 연결하는 유통 주체들이 다 같이 합심해서 서로 잘 살 수 있는 방안을 모색해야 된다고 보고요. 지역 농산물 직매장을 만들어서 직접 소비자와 지역 농가를 연계하는 그런 사업들을 진행할 예정입니다.
These campaigns to help local farmers have been a win-win deal for both Korean agriculture and ordinary consumers looking to scrimp and save amid the pandemic.
전파력이 강한 델타 변이와 휴가철 이동이 맞물리며 유행이 큰 규모로 증가하고 있어 단기간에 유행을 통제하기가 쉽지 않은 상황입니다.
거리 두기를 강화한 지 한 달이 넘었습니다만 기대했던 효과는 아직 나타나지 않고 있습니다.
10월이면 전 국민의 70%가 2차 접종까지 완료할 것이며 목표 접종률을 더욱 높일 것입니다.
It's been well over a month since Korea's daily tally has been recording 4-digit numbers, and current social restrictions have yet to tame the fourth wave, even as the academic arena kicks off its autumn curriculum. For more on the local situation, I have Professor Chung Gi-seok from Hallym University. Pleasure to have you with us, Professor Chung.
Thanks for having me today.
And I also have Professor Yu Byung-wook from Soonchang University. Good to see you again, Professor Yu. Professor Chung, we'll start with you then. We've just marked an end to a long weekend during which many are believed to have ventured outdoors to make most of the holiday. Do you expect a further surge in our daily tally in the days ahead?
Yeah, I'm afraid we'll see a new record high maybe this week. Today we had the number 1,373. It's a bit looking smaller than before, but it is still over 100 cases higher than previous peak in third wave. This is a very high number. And we are at a situation that the Delta is increasing. We are keeping a same social distancing level for over 1 month in capital area. And we do not catch up at the vaccination rate so far. So it's only 20% have been fully vaccinated so far. So if we see this kind of trend for weeks' time, then we'll see a very high number of very severe cases. Let's say about, we'll see 2,000 confirmed cases every day. About 3% will be progressed to critical care patients. Then the number is 60 per every day. And if it keeps going for 2 weeks, the number will be 840. Because the average staying duration is about 2 or 3 weeks in ICU. Once you get into ICU, you cannot get out until 2 weeks or 3 weeks time. So the number 840 is equivalent to 10% of whole ICU beds in this country. So the 10% of ICU will be occupied by COVID-19. It's another disaster for other patients who are suffering from other diseases. So in order to prevent that, we had to do something right now. The only way is to strengthen the social distancing. But if you, even though you start today the social distance level, then you can see the effect 7 days or 10 days later. So we don't have much time.
Right. Professor Yu, authorities believe that Thursday's COVID-19 numbers will offer them a better gauge of the current situation, as those figures are tallied in the absence of the weekend factor. What is your outlook for the latter half of this week?
Well, last of this week, probably the jump up again. So unfortunately, because the test is done well, even the long weekend, but the number of tests is comparatively the weekday is much less. So people are enjoying the long weekend and the end of the summer holiday. So we are highly recommend please do the test for the COVID, but they didn't. So that's why whenever it's the consequence of the COVID-19, this case is confirmed by the tracing, probably the case of the test is higher. And then probably the confirmed case is getting higher more. So that's why we have to watch about this week, especially Thursday and Friday, and then we can tell this is a condition will be better than last week or the nearly same, and we are just seeing the kind of the ghost in the mirror of the COVID-19.
Right. Professor Chung, as you mentioned, level 4 restrictions have been in place in the Greater Seoul area for over a month now, and some pundits like yourself are probably saying that these measures have been proved to be largely ineffective. Could you tell us more?
Yeah, I'm afraid it's not working now because it's over almost 5 weeks on level 4 in capital area. In non-capital area, we're having level 3 or level 4 depending on the area. But we don't see any decrease, or we don't see any decrease of curbing of a tendency of increasing so far. So there are several ways to curb this surge. If you have a very effective therapeutic agent, you can curb this one. But any kind of antibody treatment or any antiviral drug like remdesivir or Recurona seems not working very well. And if you are equipped with a vaccination, fully vaccinated people, more than 50% or 70%, you can curb right now. But we don't have any measure except for keeping a social distancing. So that's why I'm insisting on the social distancing level to be up rather than seeing all the way from the beginning. So some people say that the paradigm shift is needed right now. They say that stop counting the patients and just focus on critical care patients and reducing the death. It is a right theory, but not now. If you stop counting patients, then people lose the alertness, and the government will not take care of all the social distance level very hardly. Then you'll see a gradual increase of patients day by day. And if you see 3,000 patients every day, you will end up with 9 deaths every day, because the death rate from Delta variant is 0.03. So it's very, very high, still very high one. So, I mean, 0.26, not 0.03. So that results in a very high number of deaths every day. And again, the hospital will be filled with COVID-19 patients. So if you don't count patients every day, and if you lose the social distancing level, then the hospital will be occupied with the patients, and the society will be disturbed by those kind of situation. Then can we cope with that kind of situation? This is a life versus economy issue. So if you like to save life, you have to forgive. You have to abandon the money. So money versus life things. So what would you choose at the moment? So for the time being, you have to save lives until we have proper armament, like a vaccine or like an antiviral agent.
Right. Professor, you're keeping in mind what Professor Chung has just said. What do you propose then to better tackle this current wave?
Well, we have the special way to management the social distance, what Professor Chung comments. But compare then, we have the 5 different tiers level, like a 2.5, 1.5, you remember. People, we started a 4 tiers social distance measure. Let's directly compare to 2.5 and now at 4.0. 2.5 is more strict. So for example, like a cafe and cafeteria, is only takeout is available. It's not allowed in gathering inside of the dining state. So this Friday, I'm expecting that the government will announce if we want to keep on the social distance level 4 in Seoul and metropolitan area, we should be point on it's better to then people are not gathering. We can take the experience from 2.5 level of social distancing measure. We can apply it on this measure. It's only one way to go.
Professor Chung, would you agree then when you talked about raising our current restrictions, because they are currently at the highest level, level 4 restrictions, but you've called for stronger measures. Could you give us some examples?
Well, for instance, like Dr. Yu mentioned, 2.5, the operation hour was until 9 o'clock instead of 10 o'clock. So you can restrict the operation hour for non-essential facilities like bars, restaurants, game rooms, and etc. and etc. But those policies will be compensated by financial support. Then, if it's not the case, then nobody will follow that. And the other way to for additional policies to make people working at home and contact online. So in order to do that, the government and the public facilities should do first. Then the private sector will follow. Another measure is to make a curfew from midnight to 4 o'clock a.m. In the morning. The reason why I insist on that is that's a very low activity time zone. So the shops are closed 10 p.m. Then they have enough time to go back to their home. And many people would like to enjoy after 10 p.m. Then they have to hurry up they're going home because of a curfew. And if there are some people who should do something, some economical things, some social things, then they can get a pass from the government. Then they can go anywhere during the curfew. So making a curfew is making people more alert. We are such a very dangerous period, then we should follow social distancing rules and etc. So that's the measure I could think. In addition, the local government should do something. They know in detail in their area. They should do something. They should impose sanctions. They should encourage people to follow and abiding by restriction rules. And they should do something to prevent infection in their own area.
Right. Now, Professor Yu, this is something Professor Chung touched upon earlier, but what are your thoughts on the adoption of an early exit strategy, as in instead of focusing on keeping our daily tally down, perhaps focusing more on managing the critically ill patients?
Well, we're learning from the two countries. First is England and India. England, a day before, I watching the TV, the soccer game, Mr. Son win against Manchester City. So we're watching that no one wear a mask, but full the crowded stadiums. This is one of life. Another is India. India, they're gathering the immunity from the natural COVID-19 infection with a huge sacrifice. So which is a better one? We still have questions. But current situation, in my opinion, as experts, Korea, we have to waiting till at least 70% of national inoculation program, and then we should be turned into the learn from COVID-19, living together. Why? Korean people are watching in the world through the Arirang and another channel. They're watching it. Yes, Korea is the developed countries or developing countries or underdeveloped country. We have a certain vision of life. So vision of life, as with the response, probably government should the vision in around the Chuseok when we achieve 70% of the inoculation, and then probably we need a turning to live with COVID-19, but not right now.
Right. Professor Chung, you've often spoken about the importance of fully vaccinating our elderly instead of offering one dose to a wider population. Having said that, where does Korea stand in terms of inoculation for its senior citizens?
Well, the age 60 and over are well equipped with the vaccination, and that's why we are seeing less fatalities and less admissions in those age group. But for age group of in their 50s, we are seeing some bad news, because about 40% of admission, severe cases or fatality is from coming from the age group 50s. So I like to advise that we have to cover those age groups, 50s first, and then move down to 40s. But the government is going to cover all age groups from 18 to 50s. And they extended the interval from 3 weeks to 6 weeks. The reason why they are doing is they are going to cover as many first vaccination as possible. But I would recommend first complete the second vaccination first in 50s, and then move to 40s and 30s. Because by doing that, you can reduce the severe cases and the mortality cases in 50s. Then you can move to a new paradigm. If you do not have many admitted patients, and if you don't see many fatal cases, then you can live with COVID-19. It's mild. That will become a mild case of influenza, or mild case of pneumonia, who can be treated in outpatient clinic. If you don't cover the 50s, then only first vaccination can cover only 33% of Delta variant, either AstraZeneca or Pfizer. That is not enough. That's not working as a vaccine. If you like to or any kind of vaccine to be working, there will be more than 50%. 33% is not a vaccine at all. So I like to recommend again very strongly to cover fully vaccinated people in elderly first, and then move to a younger group.
Younger people.
Yes.
All right, Professor Chung, as always, thank you very much for your insights. Professor Yu, thank you very much for your thoughts today. Right, now remember the 3 C's against COVID-19. Avoid confined, crowded and close contact settings. Thank you for watching. See you on Wednesday.